The city of Grand Rapids plans to expand partnerships with mental health services.
The effort is part of a new policing effort by GRPD. They plan to make it public next month.
13 on your side's Elena Holland tells us how this partnership could work.
So the idea is to have mental health professionals go with police to certain emergency calls. The goal is to help those suffering a mental health crisis while police are not over-responding to a nonviolent situation.
Law enforcement agencies throughout the country are trying to find better ways to improve services in police communities differently ever since the death of George Floyd and Breonna Taylor.
City Manager Mark Washington says Grand Rapids is working on a way to improve policing and first response. Partnering with mental health professionals on a co-response model is one step toward that goal. These workers would assist with calls such as drug overdoses, suicide crisis, drunken disorderly conduct, and neighborhood disputes.
Number one, it's just more efficient. Number two, it's safer, and it's safer for the person that's calling to make sure that we have someone to assist. It's safer for the officer. And it helps with de-escalation.
The plan is still in the works, and the Mental Health Service Partnership has yet to be announced. On August 11th, Grand Rapids Police Chief Eric Payne will be unveiling the new strategy. But those who work in the mental health field say this is a great first step.
It could cut down on arrests and jail time, the use of force by law enforcement, because many times when a police officer comes onto a scene, that can agitate someone in general. And if they're under the influence of drugs and alcohol, they are not thinking clearly at that point either.
The new plan will increase the support for the current homeless outreach team by having that mental health worker there immediately, not hours later for a follow-up.
And can you imagine that somebody maybe has never been actually offered the correct help and treatment at that point, at that first time where they might be encountering a mental health crisis? It's pretty amazing to be able to offer them services at that time.
Washington says this plan comes back to listening to what community members are saying and watching what's happening around the country.
So I think all of this is relevant to some of the recent conversations about how to improve policing and how to do community policing better in this community.
In Grand Rapids, Elena Holland, 13 on your side.